hopefully you planned on being at the joint meeting of the Senate and House Appropriations Committee. If not, this may be a good time you want to exit. It can get very long. I'm so glad that we have our Sergeant at Arms, Nina Lage and Terry McCraw. I don't know, we would not be able to do what we do in this General Assembly if it was not for our Sergeant at Arms, and I appreciate them so much. It's not only in committee meetings, but it's in the chamber and any other time we need them. So I always give them a shout out if you run by, so thank y'all very much. Also, we have some pages with us today. We'll start with our Senate. We have Lakin Wilson, and she's from Lake Waccamaw, and she's being sponsored by Senator Rabin. Lakin, are you with us? Oh, okay, great. Good to see you. Thank you for being here. And also we have 3 House pages. Brooke Cameron Simmons is being sponsored by Destin Hall, the Speaker. And Daniel Echeverra is being sponsored, I think, by his dad, Brian Echeverra. And Kendall Ellis is being sponsored by Speaker Destin Moore. Thank you all so much for working with us this week. I think we gave you some hand claps and honor yesterday, but thank you so much for being here today.
Also, Ms. White, there were some Senate pages too.
Okay, I'm sorry. That's some additional ones? Okay. I'm sorry. I had been given a separate note for the Senate pages. I didn't realize we had 2 more. Carrie Bridges and Sherry Hedrick. Gary Bridges and Sherry Hedrick. Great. Thank you all so much for being with us. Okay. We have a lot of reports today from Fiscal Research, and we have great people here with us from the Department of Health and Human Services. Thank you all so much. Looking out at you all and the topics for today, I just feel like I'm back at the Division of Age and Adult Services, Department of Health and Human Services. So thank you for being with us today. I appreciate that. So we are going to start with Division of Aging and Adult Services. And Francisco Villagrana. Just go ahead, Francisco. I practiced all night, but I didn't get enough sleep to remember how to.
Thank you, Madam Chair. No worries. It's a difficult name. I don't make it easy for y'all. Good morning, committee members. My name is Francisco Celis Villagrana. I'm an analyst with the Fiscal Research team on the Health and Human Services team. And today I'll be providing you all with an overview of the Division of Aging and Adult Services. So I'll begin with a broad and brief overview of the Division of Aging and Adult Services. I'll then review the division's budget, and then I'll provide further detail on some of the major programs and services in this division. So starting off with a general overview, the Division of Aging and Adult Services aims to promote the independence and enhance the dignity of North Carolina's older adults, individuals with disabilities, and their caretakers. And similar to other social services, many aging and adult services are managed through a decentralized system in which the federal government mandates many of the services and or sets many of the parameters and rules around them, as well as provides a good deal of the funding for them. Then the Division of Aging and Adult Services provides the oversight, guidance, and technical support to the 100 county departments of social services, which are the entities that are administering most of the services and benefits on the ground floor. But there are also 16 area agencies on aging, which were established by federal law. And these entities also administer some services as well as help the counties in coordinating some of the services. So this slide includes some of the major Division of Aging and Adult Services programs. I'll be going over these in more detail later on, so I won't go over them right now. I will point out that the main ones I'll be covering include home and community-based services, the Key Rental Assistance Program, as well as state county special assistance. And I'll point out now at this time that if you remember from yesterday's presentation on the Division of Social Services, there was a large part of that division's budget which was actually for aging and adult services. And most of that funding there was for the state and county special assistance. So just something to note now as I cover this program later on. So now moving along to the budget of the Division of Aging and Adult Services, starting with a 5-year history. You'll see that overall the total budget has not varied too much over this 5-year period, in particular over the last 3 years, including the current authorized fiscal year's budget. There has been an increase in net general fund appropriation over this timeline, and that can mostly be attributed to increased state funding for home and community-based services, as well as for the key rental assistance program. And as has been the case with most of the Department of Health and Human Services divisions, this division's budget, as you can see, is primarily supported by receipts, which are mostly made up by federal funds. So now taking a closer look at the current year's authorized budget, once again, we have a division where the vast majority of the funding goes towards aid and public assistance, sitting at over 90% in this case. I'll also include on this slide the fact that this division has 79 full-time equivalent positions with a vacancy rate of around 9%, which is relatively good compared with most other state government agencies. Sticking with looking at the current year's authorized budget, but now looking at where the funds are coming from, you'll see that over 60% of the funding comes from the federal government, while net general funds make up nearly a third of the budget, and most of what is left is then made up by county funds. This next figure provides a breakdown of the current year's authorized budget by the service or program area. So you'll see that the largest slice by far is funding for the home and community-based services. Next is funding for emergency housing at over 10%. And this is fully made up by federal grants that go to local governments and nonprofit organizations to assist them with operating expenses at homeless shelters and for homelessness prevention services. Then the key rental assistance program comes in at about 5%, as well as adult protective services. Now, looking at just where the net general fund appropriations are going in this current authorized fiscal year's budget, you'll see that it's really just two things. It's home and community-based services at over 3/4, and then key housing rental assistance coming in at 16%. And again, I'll note that in all of these budget slides, the state county special assistance budget is not included because that budget primarily sits within the division of the division of social services. So these charts would look quite a bit different if that program were to sit within the division of aging adult services, or the funds, I should say. But just pointing that out again as I talk about that program later on. So moving on to some of the major services and programs under the division of aging and adult services. Starting with home and community-based services, which, as you all saw, makes up the majority of this division's budget. Most of the home and community-based services are provided through the Home and Community Care Block Grant, which is unlike most other block grants that we talk about in the Health and Human Services realm, in that it's not a federal block grant. Rather, it's a block grant that was established by the state. Specifically, it was established by the General Assembly in 1992 to improve the planning, management, and coordination of home and community-based services for older adults and their unpaid primary caregivers. Decisions on the specific services that are funded are determined at the local level at the counties, as well as the administration and procurement of services. The block grant is comprised of federal funds, most of which are coming from the Older Americans Act, as well as net general fund appropriation, and roughly 10% coming from county funds as well, since that is a requirement with this block grant. In terms of eligibility, there aren't many restrictions, except for most services are provided to individuals who are 60 years or older and their primary caregiver. Priority, though, is usually given based on factors such as whether an individual is deemed vulnerable, meaning that they are either receiving adult protective services or are at risk of requiring those services, or if they have impairments or disabilities. So this slide lists the full 18 services that can be funded using home and community care block grant dollars. So I won't be going over them. They're mostly here for your reference in the future. Although, as we'll see later on, there's really just a handful of these services that are dominating the services that are being provided. So looking at the funding makeup of this home and community care block grant over the last 7 years, I'll point out a few things. First, overall, there has not been much fluctuation in the amount of general funds used for this block grant. And Similar with county funds, not much fluctuation there except for in the previous fiscal biennium where there was a slight uptick in those county funds. But really what's been driving the changes or the fluctuations in the funding of this block grant is the federal funds. And much of that, as you might imagine, is due to supplemental funding provided through various federal COVID-19 funding bills. So you will see that this current year's authorized budget has come down a bit from the previous highs from the last biennium, and that is a trend that is likely to continue to grow. So moving on to looking at the individuals that have been served over the last 7 years through home and community care block grant services, you'll notice that the trends follow pretty closely to the budget trends in the previous slide, although the number of services provided has come down a bit more quickly following the COVID-19 pandemic years. Still, in the previous full fiscal year, 2023-24, there were over 70,000 individuals that received at least one form of service through this block grant. Area agencies on aging also track when individuals who request services are waitlisted, and those counts are reflected by the lighter portions at the top of these bar graphs. Now looking just specifically at the last bar graph on the right there, the last fiscal year's 2023-24, and taking a look at the specific services that people received or were on a wait list for, you'll see on the very left there that the overwhelming amount of services that were provided are meals, both in congregate settings, so group settings, as well as home delivered meals. So you can think of Meals on Wheels. And this category is on a separate graph because, as you can see, just the magnitude of services is much greater than the number of services, the amount of services provided for the other categories, which are shown there on the right. And the main large services there include transportation services, in-home aids, adult daycare and adult day health services, as well as housing and home improvements. Now, thousands of these other services were provided in the last fiscal year, and you'll also see that the largest proportional wait list does correspond with the in-home aid services, as well as the housing and home improvement services. So moving on to talking about the State and County Special Assistance Program, or SA. This is a program that was established by the General Assembly that provides cash assistance payments to low-income individuals requiring assistance with activities of daily living. So that includes things like bathing, feeding, doing housework, things like that. And this program is really North Carolina's add-on to the Federal Supplemental Security Income, which again is a federal program that provides monthly payments to low-income individuals with disability. So because of that, there are some broad federal rules and parameters that apply, but overall the state has a lot of flexibility in setting guidance for this program, such as the income limits as well as the benefit amounts. Something important to note is that this is an entitlement program, which means that anyone who applies and qualifies must receive the services. No one can be turned away. And this is one program, but you can kind of think about it as having two segments within it. One is a population that resides in facilities, and that's mostly adult care homes. And for these individuals, their benefits go directly to the facility to help pay for their room and board. And then there's a segment of the population that remains in their communities, in their own home. They also receive benefits which they can use to cover their housing costs, utilities, groceries, payments for in-home aid, things like that. Another thing to note is that for participants with a dementia diagnosis, there are higher income eligibility limits as well as higher benefit levels. And talking about the eligibility for this program, to be eligible, an individual must require assistance with activities of daily living. They must be either 65 years and older or an adult aged 18 to 64 with a permanent disability, and they must be low income. And you'll see on the table to the right there, the current year's income limits. And again, as you'll see, individuals with dementia are eligible for a more enhanced income limit and benefit amount. I did mention that specifically these are the income limits and benefit amounts for this year because as of 2023, the income limits are increased annually based on the Federal Social Security Administration's cost of living adjustment. And finally, I'll note that as the name of this program suggests, The funding for the benefits, which makes up the majority of this program's budget, is funded evenly with state and county funds. So on this slide, we'll see the number of individuals that have received special assistance benefits over the last 2.5 years or so. So the darker area at the top shows the individuals that remain in their homes, and the lighter portion at the bottom there shows the individuals who reside in facilities. And I did mention that at the start of 2023, the income limits and benefit amounts are subject to a cost of living adjustment. Another thing I want to add is that at that same time, there were many changes that went effect into this program, particularly with how the in-home segment is managed. So prior to 2023, the in-home segment of the population was subject to different eligibility standards, benefit amounts, and there was also a limit on how much of the total program's population could actually reside in their own home. So those differences were done away with in 2023, and as you can see on this graph, since then, this segment of the program's population has been growing considerably, and it's really driven the growth in this program's population because, as you can see, the facility portion of the program has really kind of stabilized over the last 2 years or so. I do have an appendix at the end of this presentation where I do provide a little bit more detail on those differences that existed in this program prior to 2023, so that is there for your reference. So now looking over this program's budget, as you can see here, the bulk of the program's budget and expenditures, as I mentioned, is made up by the monthly assistance benefits. There's also some administrative funds that go to counties to run this program, and most of those funds are sourced from Medicaid dollars. There is also a small portion at the top of the bar graphs that is the administrative funds that do sit within the Division of Aging and Adult Services. As you can see, that's a pretty minuscule amount at less than 1% or about 1% of each year's budget. Again, for the funding for monthly benefit amounts, these benefits are supposed to be funded evenly between state and county dollars. Although I will say that in the last few years, due to some budget technicalities, this program's budget has actually had an imbalance where state general funds have been budgeted at a greater amount than county funds. So I'm just mentioning that now so that you are not surprised if later on in the budget process there might be some technical adjustments made to address that. Now, as you can see in the earlier years shown on this graph, the expenditures for this program were decreasing, and this is because during these years the income limits were not subject to cost of living adjustments, and also because of how the in-home program was managed differently, as I mentioned in the previous slide. So following fiscal year 2022-23, when those changes went into effect, we now see that the expenditures did increase in the last fiscal year, 2023-24, compared to the 22-23 fiscal year. And then the last bar graph there is showing the current year's authorized budget. So that's not the actual expenditures for this year, of course, since we're still halfway through, but I do expect that total expenditures at the end of this fiscal year to show another increase compared to the prior year. And I also expect that to be an ongoing trend in the future. So moving on to the Key Rental Assistance Program. This program is a partnership between the Division of Aging and Adult Services and the North Carolina Housing Finance Agency. And this program provides individuals who are low income and disabled with rental assistance. The housing units that are used for this program are those housing units that received funding from the low-income housing tax credit. And so these units are known as targeting program units. So under this program, participants pay no more than 25 to 30% of their income towards the rent. And then the Key Rental Assistance Program provides the assistance amount at the difference of the rent and the individual's income that goes towards the rent. So this program's kind of covering that difference. As of last month, there were 2,156 cases of key rental assistance and over 8,000 people on a wait list for targeting unit homes. The average assistance payment for this program in the last calendar year was $392. In terms of eligibility, individuals must have a permanent disability. They must also have gross incomes below 50% of the area median income, but they must have also a minimum gross income of at least $300, and that does include Social Security benefits, which most of the individuals who are eligible for this program are already receiving. So continuing to talk about key rental assistance, but focusing on the budget. In the last full calendar year, the average monthly burn rate or spend rate for this program was around $825,000. And the recurring funding that the Division of Aging and Adult Services has for this program equates to around $610,000 per month. So if you're good at math, you'll notice that this program's spend rate is higher than its recurring funding. Now, that does sound alarming, but I'll point out that this program is not facing insolvency anytime soon because it does have a substantial fund balance of around $20 million as of a couple months ago. And the reason why the existence of this relatively large balance is that in 2020, the Key Fund did receive a one-time infusion of $10.5 million from the Housing Finance Agency's Community Living Housing Fund. And also for the last few years, the Department of Health and Human Services has also been reimbursing the Key Fund for key rental assistance payments that have been made on behalf of transitions to community living participants. And as you'll recall, this is a program that is intending to provide supports and assistance to individuals with mental illness so that they can reside in communities instead of facilities. I'll also mention that the Division of Aging and Adult Services has estimated that the average monthly expenditures for this calendar year will increase to around $1.1 million a month due to increases in the key payment standard, as well as an increase in the number of households receiving assistance. So I've just got a couple more slides here where I'll be covering some of the other main Division of Aging and Adult Services programs. First is caregiver support, which includes a range of services and supports for unpaid family caregivers. And those services can include counseling and respite care. In fiscal year 2023-24, there were over 3,400 cases where a caregiver, unpaid caregiver, received some support service or assistance. And most of these programs and services are funded through federal dollars. Next is the Long-Term Care Ombudsman Program, which seeks to provide residents of long-term care facilities assistance in understanding their rights with regards to residing in long-term care facilities, as well as assisting in the resolving of grievances that individuals might have with the facilities that are caring for them. There is a state ombudsman office as well as 16 regional offices that are housed in area agencies on aging. And I'll point out that in federal fiscal year 2022-23, there were over 1,700 complaints addressed and over 2,800 cases that were closed. And most of the services provided through these offices are funded with federal dollars. Moving on, there's also Adult Protective Services, or APS, and these services seek to identify and prevent the abuse, neglect, and exploitation of older adults, particularly those with disabilities. So you can think of this service similar to how in the Division of Social Services there are child protective services. So this is doing much of the same kind of work, just with a different population, that being adults. So in fiscal year 2023-24, there were 38,400 reports, and most of these services are funded through county funds with some federal funds used as well. Then sometimes after the involvement of Adult Protective Services, some adults are entered into what is known as a guardianship case. And these are instances in which a person or agency is appointed by a court to make decisions on behalf of a person who is deemed to not be able to make decisions regarding their own welfare or finances. In fiscal year 2023-24, there were nearly 8,000 adults who were served under guardianship. And I'll also point out that the Division of Aging and Adult Services, on behalf of county departments of social services, manages contracts for over 1,400 individuals who are served by one of 6 private guardianship corporations. And statewide, the cost for these contracts is nearly $4 million per fiscal year. So before concluding, I'll quickly go over some of the main takeaways from this presentation. North Carolina's aging and adult services are primarily administered at the regional and local level by county departments of social services, as well as area agencies on aging. And some of these services, particularly those that are home and community-based services, can vary by county, since counties can establish which services to prioritize and direct funding towards. As we saw, the home and community-based services do make up a bulk of this division's budget, although that is, again, excluding special assistance, which most of the funds for that program do sit in the Division of Social Services. So special assistance, that program's population and expenditures have been growing due to recent changes in how the program is structured, and those trends are expected to continue to grow. And lastly, the KEY program, which I mentioned, provides disabled individuals who are low income with rental assistance. This is the second largest program in the Division of Aging and Adult Services in terms of where the state general fund dollars are being spent. And Madam Chair, that concludes my presentation.
Thank you, Francisco. Job well done. Super job well done. We're going to hold all questions until the last two presentations are done, as we've been doing. So we'll just hold your questions and we'll get to those. Next, we have Division of Health Services Regulation, and Susie Camilleri is going to present. Thank you, Susie.
Thank you, Madam Chair. Good morning, chairs and members. My name is Susie Camilleri with the Fiscal Research Division of the North Carolina General Assembly, and I'm about to give the first overview of 4 divisions that I'll be covering in today's meeting, starting with the Division of Health Service Regulation. The other 3 overviews will be combined into my next presentation. So we will look at the division's authorizing laws and responsibilities first. At a high level, they are, they have regulatory oversight and enforcement functions over a variety of different types of facilities, including healthcare facilities, certain health professions, emergency medical services personnel, local jails, and the state's radiation protection program. They also serve preparedness and planning functions, including providing projections of need that guide local planning for certain healthcare facilities, services, and equipment, and they administer the state's healthcare preparedness program. So this slide provides a list of some of the key authorizing statutes that govern the division's responsibilities. I won't go over them all, but they are here as a reference for you all. And we'll look at the division's budget next. Like most of the other divisions, they are mostly receipt supported, and their main source of receipts come from licensure and certification fees, and they do also receive a fair amount of federal funds as well. However, unlike most other divisions, the largest portion of this division's budget is for staff, making up 77% of their expenditures, rather than aid and public assistance, which is typical of most other divisions. However, that is their next largest chunk of expenditures, coming in at 10%, and these are funds that go to hospitals to support preparedness and response activities, as well as funds that go to organizations that benefit nursing home residents. They have about 589 FTEs, with a 14% vacancy rate, which is lower than the department as a whole. And you'll find most of the FTEs under the nursing home and adult care licensure section, the mental health licensure section, and the acute and home care licensure sections. This slide shows total requirements by functional area. And as you can see, licensure, certification, and inspections take up most of the division's budget at 76%, with nursing home and adult care making up the majority of that. Preparedness and planning and admin each make up about 12% of the division's budget. All right. This slide shows sorry, got my slides confused. This slide shows the breakdown of the net general fund appropriation and how it's distributed among the division. Again, licensure, certification, and inspection makes up the most of the general fund with 81% total, and nursing home and adult care once again making up the majority of that section as well. Jails, detention, inspections is 100% covered by the general fund, while the statewide health planning is nearly 100% receipt supported. And you'll notice that radiation protection and healthcare preparedness are not in this graph, as they are fully receipt supported sections and don't receive a net general fund appropriation. And I'll also note that the administration section is more heavily weighted toward licensure, certification, inspection, as that is where most of the funding and staff are under the division. Okay, we'll take a look at division programs, starting with its regulatory and oversight functions, since it does take up majority of the budget and staff. The division provides regulatory oversight and remedial activities to assure state licensed and federally certified providers maintain compliance with state and federal laws governing the quality of health care rendered to recipients of acute and home care, adult care, mental health care, and nursing home care. Under agreements between the state and the feds, state survey agencies, as they're called, which DHSR is for North Carolina, carry out the Medicare certification process, including initial and ongoing inspections. These surveyors or inspectors are the same staff that also investigate complaints that may be lodged against facilities. The state is reimbursed for certifying and inspecting facilities on behalf of the federal government. They also inspect local jails to monitor compliance with rules and laws and administer the state's radiation program, which protects the health and safety of North Carolina from sources of radiation. The division also credentials nurse aides and adult care home admins. They maintain the nurse aid registry and provide oversight over EMS agencies and personnel as well. This table provides an overview of the over 20,000 healthcare facilities in the state that are subject to regulation by the division each year. This slide shows the types of facilities, along with how many exist across the state, how many complaints were logged just in calendar year 2024, and the number of complaints pending investigation as of the end of January of this year. Note that complaints logged in a given year may be investigated and resolved in subsequent years. Of note is the high proportion of complaints received by nursing homes, which is the result of many factors, including workforce shortage, lack of workforce competence, constant leadership change, lack of developing knowledge, among others. I also want to point out that while the division may receive complaints about adult care homes, county departments of social services also receive complaints, and they are the primary entity that investigates those complaints. Moving on to the division's preparedness and planning functions, they annually produce the State Medical Facilities Plan, which provides projections of need to guide local planning for certain healthcare facilities, services, and equipment across the state. Any person may submit a certificate of need application to develop a facility, service, or equipment for which there is a need determination made in the SMFP. CON laws prohibit healthcare providers from acquiring certain healthcare facilities, services, or equipment without prior approval from the department. The Office of Emergency Medical Services is also under the division, and they work with the state's EMS systems to provide medical direction, standardized protocols, continuing education, and quality assurance programs that support emergency care that is delivered across our state. They also administer the Healthcare Preparedness Program, which coordinates emergency preparation and response to disasters for the healthcare community, including information sharing, expanding medical surge readiness, and incident coordination. This slide provides an overview of the Certificate of Need process, which starts with the development of the SMFP under the direction of the North Carolina State Health Coordinating Council. Healthcare providers submit a CON application to develop a need determined in the plan and pay a non-reimbursable fee at that time. Applications are subject to a 30-day public comment period, with some requiring a public hearing afterward as well. They are then reviewed by the division and are either approved or denied. Within 30 days of the decision from the division, an affected party may appeal the decision by filing a petition for a contested case with an administrative law judge under the Office of Administrative Hearings. And that ALJ's decision may also then be appealed to the North Carolina Court of Appeals. And this next slide just shows the different healthcare facilities, services, and equipment that are subject to the state's CON laws. This table reflects the need for health services, health service facility beds, and medical equipment for which there is a need determination methodology in the state medical facilities plan. Note that the state medical facilities plan includes need determination for the development of many, but not all, health service facilities, beds, and equipment for which a certificate of need is required. And I will conclude with some recent budget actions affecting the division. The 2023 Appropriations Act included funding for a total of 9 FTE under the various divisions, sections of the division, all of which have been filled by this point. And then Session Law 2024-55 included funds for 2 additional jail inspector positions, which the division is currently in the process of hiring. And with that, Madam Chair, I am happy to, move on to the next presentation on the agenda. I will.
We are honored to have a special guest that's just entered the room, the new Department of Health and Human Services Secretary, Sangvai. I think we should all stand and give a moment of little praise. You know, with praise comes lots of commitment. Division of Employment and Independence for People with Disabilities, Division of Services for the Blind, and Division of Services for the Deaf and Hard of Hearing. Thank you, Susie.
Thank you, Madam Chair. Once again, I am still Susie Camilleri with the Fiscal Research Division, and my final presentation will cover the 3 divisions that Chair White just noted: the Division of Employment and Independence for People with Disabilities, the Division of Services for the Blind, and the Division of Services for the Deaf and Hard of Hearing. The roadmap looks a little different, but pretty much the same. I will talk about the divisions. They are getting ahead of myself. This is the roadmap we'll follow. Let's start with a high-level overview. So the 3 divisions are grouped into 2 separate budgets. One for the Division of Employment and Independence for People with Disabilities, which is formerly known as the Division of Vocational Rehabilitation Services, and then another budget that is shared by the Division of Services for the Blind and Division of Services for the Deaf and Hard of Hearing. So that's how the presentation will represent the 3 separate entities. And while they are distinct divisions, they do share some administrative services to create efficiencies within the department. And so we will start with the Division of Employment and Independence for People with Disabilities. The mission of this division is to assist individuals with physical, mental, or cognitive disabilities with living successfully in the community through employment services, independent living services, and assistive technology supports. It is established under Article 3 of Chapter 143B under DHHS, and Article 59 of Chapter 143 governs the state vocational rehab and independent living services programs. So here is the budget history for the division, again, mostly federally funded. You'll notice an increase in the budget in fiscal year 22-23, which is when the Office of Economic Opportunity was transferred from the Division of Social Services under the department to this division, resulting in an increase in expenditures and receipts. The division has two main sources of receipts, both of which are federally funded: the Vocational Rehabilitation Basic Support Grant and the Community Services Block Grant, which supports the Office of Economic and Economic Opportunity that I had just mentioned. So looking at the requirements by purpose, once again, aid and public assistance makes up half of this division's budget requirements, with personal services making up another large chunk, coming in at 42%. The division currently has about 1,002 FTE with a 21% vacancy rate. The majority of the personal services budgets are made up of staff that provide direct services and support the delivery of services. And the department cites insufficient wages as the primary challenges in hiring and retaining qualified staff, resulting in a vacancy rate that is a bit higher than the other divisions in the department. Looking at requirements by programmatic area, vocational rehabilitation services takes up the most at almost 70% of their entire budget. And vocational rehabilitation also makes up the majority of the division's net general fund appropriation at 57%. The general fund appropriation for the voc rehab budget represents about 19% of its total budget, the rest coming from federal funds. Next is independent living services at 33% of the division's net general fund appropriation, which is about 72% of its total budget. And while the Office of Economic Opportunity makes up about 12% of the division's total requirements, as I just noted, it is fully receipt supported through a federal block grant. We'll take a high-level overview of the programs that reside under the division, and they fall under four major areas. Vocational rehabilitation is, as I've just mentioned, the division's largest program, with most staff and budget going toward this program. It supports individuals pursuing employment through counseling, training, adaptive equipment, and other support services. It provides support to both employees with disabilities and their employers. Local VR offices across the state provide various services to individuals with disabilities, including but not limited to counseling, training, and job placement assistance. Pre-employment transition services are also provided to students and youth experiencing disabilities, and it helps them find and keep employment. Independent living focuses on providing assessments and services that allow individuals to remain in their own home. Some individuals may qualify for consumer-managed personal assistance, or consumers select their own personal assistants that help them facilitate the activities of daily living. The next program is the North Carolina Assistive Technology Program, which helps providers and families find appropriate adaptive equipment, which is to consider any item, piece of equipment, or product used to increase, maintain, or improve the functional capabilities of an individual with a disability. They provide assessments that are often required before insurance or a government program will pay for the equipment. Consumers can test different models of adaptive technology to determine which is the best fit for them. And they provide short-term loans, for example, for a temporary wheelchair ramp that a consumer is waiting for the permanent to be delivered. They have 9 field offices across the state. And then the Office of Economic Opportunity, which just recently moved under the purview of this division, assists low-income individuals and families at or below 200% of the federal poverty level achieve self-sufficiency by helping individuals find jobs, housing, food, and shelter. The work is funded again by the Federal Community Services Block Grant. And I do want to apologize to chairs and members of the committee but this slide was not in the materials that we sent out last night. I was not sure I'd be able to get the information in time, and we didn't want to wait any longer before sending it. So I did receive the information and thought it was worth including. It is in your printed materials this morning. So this table shows statistics on VR employment outcomes for the past 5 fiscal years. And I do want to note that these figures include data for VR participants in this division, as well as for the Division of Services for the Blind, which I'll speak about shortly. Since some states, like North Carolina, have more than one voc rehab agency, one for individuals who are blind and one for all other individuals with disabilities. So the data are just combined here. A few trends to note. Participation has been on the decline, which can be attributed to a few factors, including the fact that overall reductions in unemployment across the state may result in job seekers requiring less support in securing a job. And as noted earlier, the division has struggled to acquire and maintain staff necessary to provide the needed services, which could result in fewer individuals receiving supports. Despite a decline in overall participation, the number of those who exit the program employed in the second quarter post-exit do remain relatively consistent across the 5 years, and median earnings for the second quarter post-exit appear to be inching upward. So we'll conclude the presentation on this division by looking at recent legislative actions. The 2023 Appropriations Act included additional non-recurring funds for the Assistive Technology Program to purchase needed equipment. And it also included non-recurring funds in the North Carolina Community College portion of the budget to contract with the division for a pilot program that assists students with intellectual and developmental disabilities to achieve their career goals. It's a 3-year pilot program, and the program is called Bridge to Success. It's currently operating in 6 community colleges and serves about 40 students with IDD. So next, we will take a look at the Division of Services to the Blind and the Division of Services to the Deaf and Hard of Hearing. The mission of these divisions is to provide services to people who are visually impaired, blind, and deafblind to help them reach their goals of independence and employment, and to also ensure that all deaf, hard of hearing, or deafblind North Carolinians can communicate their needs and receive information easily and effectively. These divisions were also established under DHHS by Article 3 of Chapter 143B. Again, this slide provides a non-exhaustive list of the authorizing statutes for each. Like the former division I just gave an overview on, DSB is also governed by Chapter 143, Article 59, as they also provide state vocational rehabilitation and independent living services to the blind. And the Department of Services for Deaf and Hard of Hearing are also governed by the statutes listed on the slide. So as I mentioned earlier, these two divisions are distinct, but they do reside in the same budget. And again, our familiar 5-year budget summary shows that they're also majority receipt supported. Most of the receipts are from federal funds, like the VR Basic Support Grant, which the Division of Employment and Independence for People with Disabilities also receives to support individuals with disabilities other than blindness. And this budget also receives federal social services block grant funds, which provide funds to states with a primary goal of promoting self-sufficiency and reducing inappropriate institutional care. They also receive receipts from telecommunications fees that support the operations of the Division of Services to the Deaf and Hard of Hearing. And the budget does tend to remain fairly consistent over time. The budgeted amount in fiscal year 2024-25 is higher than previous actual spending, most likely due to divisions reverting lapsed salary funds at the end of each year due to vacancies. Again, it's not always easy to compare actual budgets with authorized budgets, and we will see where they end up at the end of this fiscal year. This slide looks at requirements by purpose, with personal services taking up 62% of these divisions' budget. They currently have 336 FTEs with a 24% vacancy rate, which is the same as the department as a whole. Similarly to Division of Employment and Independence for People with Disabilities, these divisions struggle with hiring and retaining qualified staff due to insufficient wages, and the majority of the personal services budgets are made up of Division of Services to the Blind staff that provide direct services and support the delivery of services. I think the breakdown is around 71 FTE for Division of Services to the Deaf and Hard of Hearing, and the remaining 266 in Division of Services to the Blind. If we're looking at the requirements by program area, again, Services to the Blind makes up 59% of the total budget, with voc rehab making up about a third of the budget. Deaf and Hard of Hearing services makes up about 35% of the budget, with admin filling in at 6%. But when we look at the net general fund appropriation, we see it's entirely made up of services for the blind, as Services to the Deaf and Hard of Hearing is fully receipt supported through telecommunications fees. Again, voc rehab makes up the majority of the funding, and while the medical eye care program is one of the smallest programs in terms of overall expenditures, it is nearly 100% state supported. We'll conclude by looking at an overview for each of the divisions, starting with Division of Services to the Blind. I won't say a whole lot about vocational rehabilitation, since I did just talk about the services that this program provides in my previous presentation. But again, this helps individuals experiencing a visual disability find employment, keep employment, or return to work. Independent Living Services offers services to assist individuals experiencing a visual disability with adjusting to vision loss and learning to live independently and safely in their homes and communities. The Business Enterprise Program also resides under this division, and it provides legally blind participants the opportunity to operate their own food service or vending facility by providing initial training for potential licensees and ongoing counseling and management services to established operators. This is a federal program that was established by the federal government in 1935 and was adopted in this state in 1955. Facility operators retain the majority of the net proceeds, although a small percentage does go to the division to assist with program operational expenses. They also get some other federal funds, and there are currently 41 operators managing facilities, including vending, snack bars, cafes, micro markets, cafeterias, and full-scale military feeding operations located in federal and state buildings, military bases, rest areas, and welcome centers across the state. And then the Medical Eye Care Program under the division offers financial assistance for individuals who have no comparable benefits and limited resources to pay for medication, eye treatments, and surgeries, with the goal of saving or restoring sight and preventing blindness. And looking at the Division of Services to Deaf, Hard of Hearing, their focus is on communication access for deaf, hard of hearing, and deaf-blind individuals, and provides services through its 7 North Carolina regional centers. And I'll provide a quick overview of each of these services, starting with assistive technology for the deaf and hard of hearing, which provides information on available technology specifically created for people who are deaf, hard of hearing, deaf-blind, and speech impaired. Relay service operators are the confidential link between hearing and deaf, hard of hearing, deaf-blind, and speech impaired callers. The relay operator voices conversation to voice users and types the conversation to users, and must voice everything typed to the hearing person. Emergency preparedness and public safety helps individuals with hearing loss prepare for severe weather and other catastrophic emergencies. They also assist emergency response agencies, law enforcement, governmental agencies, and community organizations develop and maintain systems of communication to make sure alerting and response services are accessible to people who are deaf, deafblind, and hard of hearing. Technical assistance for agencies and businesses provides no-cost technical assistance to agencies and businesses to help make their services available to deaf, hard of hearing, and deafblind individuals. Telehealth guidance and resource provides patients, healthcare providers, and American Sign Language interpreters the tools and resources needed to complete a telehealth appointment. Sign language interpreters provide licensed interpreters and interpreting agencies an opportunity to contract with the department and offers a collection of interpreting resources through the regional centers. Domestic violence support provides resources for domestic violence survivors who are deaf, hard of hearing, or deafblind. And the division also provides trainings and workshops to a variety of audiences to ensure communication access is there for both parties between those with hearing loss and others. According to the division, in calendar year 2024, they closed out about 3,000 service requests among their various programs and services. And that completes my presentation, Madam Chair, and I am happy to have Francisco stand for questions while I take a drink of water.
Well, thank you so much, Susie. And while you're taking a drink of water, I'm going to offer the presenter's podium to Secretary Sangvai, if you would like to come up and just address us for a moment.
All right. Thank you, Madam Chair, and to all the other chairs, members of the Senate Committee, as well as the House Committee. We really appreciate you taking time to meet with members of our team and also appreciate FRD's time to give you an opportunity to understand the important work that this agency does. We remain open and available for questions. We know that we're a large agency and these are unique times with respect to finances, services, and so forth. So we want to make this as much a collaborative process as possible. I also want to take a minute and thank members of my team. I know they've been working very hard to make sure that working with FRD to give timely and accurate information so that we can have a robust dialogue and move forward in the interest of all North Carolinians.
This would be a good time for them to introduce themselves. If you
Fantastic. Would you like to introduce yourselves, members of our team?
Sure. Good morning. Susan Osborne, Deputy Secretary of Opportunity and Wellbeing, which includes most of our human services programs at the department.
Good morning, everyone. My name is Chris Egan. I'm an Assistant Secretary in the department, and my portfolio has 3 of the divisions you reviewed today under Employment and Community Access.
Good morning. I'm Jill Zimmerman Lawrence. I'm the Deputy Director for the Division of Aging. It's great to be here.
Good morning. I'm Carla West, Division Director for Human Services. My portfolio includes a Division of Aging as well as a Division of Social Services, Economic Programs, and Child Support.
Good morning. I'm Karen Burks. I'm the Acting Deputy Secretary for Health.
Good morning. My name is Mark Payne. I'm the Director of the Division of Health Service Regulation.
Hi, good morning, everyone. Jansen White, Director of Government Affairs for DHHS. Thank you.
Thank you all so much for being with us for the last several weeks. At least some of you have been here every time. Thank you so much.
Thank you very much.
Now, if you have questions, if you will raise your hand and let us get a list of those. And we're going to, while you're raising your hand and we're getting a list of those, we're going to start with Senator Sari.
Thank you, Madam Chair. This might be a question both for FRD and for the department. With respect to the certificate of need presentation, I saw the numbers in the process. Does the department have any way in which it tracks utilization of certificates that have been issued?
Thank you, Senator, for the question. Can you elaborate? What do you mean tracks utilization? I'm sorry.
Sure, clarification. So, for example, if you issue a certificate for an ambulatory surgery center for an MRI, does the department ever look to see if the recipient of that certificate is putting it into use, is using it 5 days a week, maybe using it 1 day a month? What type of tracking do you do after the fact with respect to that?
Please go. Thank you, Madam Chair. I actually don't know the answer to that off the top of my head. I imagine there is some sort of tracking and oversight of that, but I think the department can probably answer that more accurately, if that's okay.
Does someone from the department would like to respond to that? Okay.
Thank you, Madam Chair. And thank you for the question. So in response to your question, when a applicant applies for a certificate of need, there are certain conditions that they have to meet that are attached as an exhibit to the certificate of need. It includes a schedule for their development of the facility, and they have to submit quarterly reports until the facility becomes licensed. Once the facility is licensed, then as part of our annual license renewal applications that all facilities must complete, we collect utilization data. And I will add that utilization data then is utilized with the State Health Coordinating Council in developing the state medical facilities plan annually.
Senator, sorry, follow-up?
Yes, for the department. Thank you, Madam Chair. Is that utilization data available, and is that something that you could share with me?
Yes, sir. If you would let us know what particular facilities you were interested in, we'd be happy to pull that information for you.
Thank you.
Thank you. Senator Gailey?
Thank you, Madam Chair. I just have a super basic question. I was very interested in the presentation about key rental assistance because I think we all regularly get requests from people who are housing insecure, especially elderly people who maybe losing their home for some reason or another. And I just wanted to clarify that for a person to access this particular service, but also other funds that may be available, that's through the county DSS. Is that correct?
Francisco.
Thank you, Madam Chair, and thank you, Chair Gailey, for that question. I do believe that county departments of social services are involved in connecting individuals at the local level with those units, although I believe that there might be some other entities involved as well. I am happy to suggest deferring that question as well to the department to see if they have further information to add.
Yeah, if we could do that, Madam Chair, for people who may be listening, advocates or others, how does a person get connected? If we have all this assistance that's available, how does a person access it?
Department, would you like to speak?
Thank you, Madam Chair. Jill Zimmerman, DHHS Deputy Director for the Division of Aging. The Targeting and Keys program is operated solely by the department. We have referral agencies that are work with an individual that needs supportive services to understand the needs that they have and then refer them into the Targeting and Key program. Currently, the wait list is at about 8,000 because of funding as well as the ability to match people with an actual unit that meets their specialized needs.
Senator Gailey, follow-up.
Thank you. Good.
Senator Bergen.
Thank you, Madam Chairman. I'm going to direct all my questions to the Division of Health Service Regulation and my good friend, Deputy or Director Payne. I had that great honor of serving on the SHIC for a number of years and worked with him. And so I'm going to start with page 13, if you want to look at that. And you and I've had some of these conversations, but I'd love for you to go through. You are charged with inspecting 21,054 facilities across the state, and it encompasses everything from hospitals to abortion clinics. I mean, it's everything. And then I was looking at the complaints, 77,741. There's 1,892 outstanding right now. I know we put extra money to try to, I know having people trained to go in and do these, and these aren't something where they walk in. It's not like necessarily like a restaurant. It's a lot more involved. I know they take a lot of time. Can you just give us an update on the outstanding complaints, what they're for? I've had some calls about some pretty serious ones that, and especially in nursing homes, that have not been looked at. Just give us and this, I'm not accusing anybody of anything. I'm just saying, tell us what's going on and what we can tell our constituents when they call and said, I filed a complaint. My mother was in whatever this condition was. Nothing's been done. Nobody's contacted me. I haven't heard from anybody. And kind of, if don't take a long time, and maybe this is a longer conversation, but is there something else we can do, either locally through police or something else, to resolve some of these things quickly? If I've heard that somebody has been significantly injured or left in a state, it's very concerning to me, thinking about some of our older folks. So if you'll talk about that, and then I'm going to switch to your favorite thing, CON, on my next question.
Mr. Bang.
Thank you, Madam Chair. Thank you, Senator Bergen. So first of all, I will start off with regard to our complaint intake process for the nursing homes. So first, I want to thank you all for appropriating some additional positions for our complaint intake unit. As you would see, if I were to show you the volume of increase in complaints, it has been dramatic. From 2015 through 2023, the volume of nursing home complaints increased by over 50%. So during that period of time, our nursing home section has not been appropriated additional positions, and therefore we are very much understaffed. We would like to be able to much more timely investigate the complaints that we receive. We do follow the CMS national criteria in triaging the complaints that we receive. Those that are the most severe are investigated very promptly, and those that are maybe not as severe, then we will have to investigate them later. It is becoming increasingly the case that as we go in for a regular survey of a nursing home, that we are taking in with us lots of complaints for investigation, sometimes in excess of 60 plus. So we're going in not only to do the annual inspection, but also all of those complaints. I will tell you too, the other thing that we are seeing, not just in nursing homes, but in other healthcare facilities, is the severity of the deficiencies that we are finding has really escalated as well. And that not only takes more time during the course of a complaint investigation, writing up the report, then there's the follow-up with regards to reviewing and approving a corrective action plan. Then there needs to be a follow-up inspection to make sure they have implemented the corrective action plan and done an, satisfactorily resolve the situation. The best survey we could have would be one we go in and find no deficiencies. There's very little to write up. Our statements of deficiencies are, just that. And if we find none, we have a clean inspection. That's great. But I will tell you, they are very few and far between. I hope I answered your question, Senator.
Senator
Yes, sir.
Bergen, if you would allow me to let the other two, Mr.
Yes,
Chairman, and then we've got 4 or 5 people and then I'll get back to you. I just know we're running out of time. Thank you. Representative Reeder, do you have a question?
Yes, thank you. Just a quick question on, Francisco, on page 14, you talk about all the different services that are available. In general, how many different services would an individual get or receive of this whole menu?
Francisco.
Thank you, Madam Chair. Thank you, Chair Reeder, for that question. So these are the full list of services that are allowed to receive home and community care block grant funding. Although, at the local level, really the counties decide basically which of the services to direct funding towards. So a particular county might decide that they want to focus on providing funds on nutrition services, housing and home improvement, and adult daycare, and not offer anything else. So it's really up to the counties. So some might offer, most of these services. Some counties might just not have the providers and the infrastructure in place to provide some of these. So it's really up to the counties to decide. Now, in terms of individuals receiving services, I don't believe there are any limits to, for the most part, individuals receiving, if they receive Meals on Wheels, I don't believe there's then a limit on them applying to receive like a housing and home improvement service if that is available in their service region.
You have a follow-up? Okay. Senator Adcock.
Thank you, Madam Chair. Actually, my question was about nursing home complaints, and you answered it in answering Senator Bergen's question. Thank you very much.
Representative Campbell.
Thank you, Madam Chair. And I will preface this question by saying I should know the answer to this, but the Dalai Lama says that growth is impossible without admitting your ignorance. If I understand this correctly, this is a certificate of need question in terms of specifically equipment purchase. There is a threshold dollar amount, if I'm not mistaken, that if it's under, you're exempt from certificate of need. But my question is that true? And if it is equipment listed there, even if it's under that dollar amount, would you still have to go through the certificate of need process?
Ms. Camarella.
Thank you, Madam Chair, and thank you, Representative, for the question. There is a threshold dollar amount, and of course, I had that last night when I was preparing my presentation at 1 a.m. But I don't know what it is off the top of my head, unfortunately. The department might be able to respond.
Mark Payne, Director of the Division of Health Service Regulation. Thank you for your question, Representative Dr. Campbell. So in terms of those specific equipment that is listed there, that is not specific to the dollar threshold. So if, for example, you wish to purchase a linear accelerator, then you would need to apply for a certificate of need.
Do you have a follow-up, Representative Campbell?
No, that answered my question perfectly. Thank you.
Representative Servania.
Thank you, Chair White. I have a follow-up question to Senator Bergen's and then my own individual question. So this also goes on to nursing homes. This prefacing also by saying it doesn't change the realistic situation of increase in investigations and complaints. But from what I had learned, our state law in terms of timeliness of investigations from complaints is much more stringent than CMS's regulations. Is that correct?
Representative Payne. I mean, Mr. Payne, sorry.
Thank you.
I just heightened you.
I got a promotion. Thank you.
Lower pay, though.
Thank you very much, Madam Chair. Thank you, Representative Carvalho, for your question. So you're correct. The state law was enacted in 1977, and it requires complaints to be investigated within 60 days. I don't have the data for the number of complaints that were received in 1977 in comparison to the number that we're receiving currently. I can tell you with the data that I have, even as 2015, we received about 2,500 nursing home complaints. We are now between 3,500 and 4,000 per calendar year. So while I regret that we are not able to meet the state statutory requirement, I will say in talking to staff who have been in the division for a number of years, that really has not been resourced in a way that they were able to meet that. Instead, what we focus on is the CMS national standards, and we have been very successful through lots of hard work and so forth in meeting those until this most recent federal fiscal year. If I may add too that, you know, I'm pleased that our vacancy rate is 14% below the department's vacancy rate, but nonetheless, obviously concerning. Senator Bergen and I have had several conversations regarding looking at vacancy rate as well as looking at turnover rate. I think turnover rate is more insightful from a business operations standpoint. I pulled some data with regard to our nursing home surveyors for 2023 and 2024. We had a vacancy rate of 13% among our nursing home surveyors. Our turnover rate in 2023 was about 21%, and our turnover rate in 2024 was almost 25%. Wow. There are a number of factors that contribute to that. For one, we don't pay a competitive wage. Two, our surveyors are not subject to the Fair Labor Standards Act, so per state policy, we're not able to pay them overtime, although we frequently call upon them to work overtime. And in fact, one of CMS's criteria for us is a certain percentage of our inspections have to begin on weekends and nights and off hours and so forth. There's extensive travel involved for our surveyors and overnight stay. And on top of that, you know, the situations that, you know, the volume of work they're trying to deal with, the volume of complaints they're taking in, and then, quite frankly, some of the just horrific conditions that they occasionally find. I've had our folks share with me some of the pictures, and it really does have an incredible effect on me, and I can't imagine the effect that it has on my nurses and social workers, dietitians, and so forth that are there, you know, seeing the nursing home resident with slipper socks around her hands and rubber bands at the wrist. And then when they were removed, obviously her hands swollen with blisters in her palm, that just horrific. In that case, the police were involved. And we do refer situations like that to the police.
Thank you, Mr. Payne. Representative Serrani, we're going to move on and make sure everybody gets at least one question. If we have time, we'll come back.
Thank you.
We're running out of time. Representative Basani.
Thank you, Madam Chair. So my question goes back to slide 15 of the presentation on the three divisions, including the Division of Employment and Independence for People with Disabilities. There's a pilot that was mentioned, Bridge to Success. I believe you said that it's currently operating in 6 community colleges and serves about 40 students with IDD. Can you tell us which community colleges those are?
Ms. Camilleri.
Yes, Madam Chair, thank you. And I do have that information. Let me just find where. There it is. So the community colleges are Alamance, Asheville Buncombe Tech, Brunswick, College of Albemarle, South Piedmont, and Wilkes Community College.
Do you have a follow-up, Representative Buwanza?
Yes, thank you, Madam Chair. One follow-up. So I understand the goal is to assist students with intellectual and developmental disabilities with their career goals. Could you tell us about what the measures or indicators of success for that program will be?
Thank you, Madam Chair. Thank you for the question. I would have to defer that one to the department. I don't have that information readily available at the moment.
Please.
Thank you, Madam Chair, and thank you, Representative, for the question. This is modeled after how we work with certain public school systems across the state as well, and have agreements to have more immediate access to an employment counselor. And in this case, this collaboration with the community college system is helping us to expand our relationship with post-secondary education opportunities. And we're excited about this because it can mean supports in the classroom. You saw a lot of the different services that we can provide. We have relationships with local community rehabilitation providers. If an individual needs additional support to be successful, they could be involved in helping that support that person on a day-to-day basis. Ultimately, the goal is to learn, but also to leave with a certificate recognized by industry so that this can more quickly lead that individual into competitive integrated employment. And we can certainly follow up with more details on this if you have further questions.
Representative Cunningham.
Thank you, Madam Chair. I'm going to make a few comments, and then I'm going to ask a question. The ratio inside of a nursing home facility, skilled nursing facility, is 1 CNA to 13 clients or patients, however you want to refer to them. I've been through the survey. It's very intense, and usually it's unannounced when you all show up. And you may stay a week going through our documents, looking at if the nurse aide is doing what she's supposed to do, what the nurse is supposed to do, and what administration, social worker, PT, occupational therapist, and all of that. We have been down by 9 nationally for the ombudsman. Nationally, if we got 9, we'd be up to where we're supposed to be. And that's the complaint line where people call in. My question is, since the pandemic, have we seen an increase in any new facilities in North Carolina? Because I know we're in trouble in the facilities. So have we seen anyone come into North Carolina other than the ones that we've already accounted for, that 400 and something that want to come in and build a new facility?
Mr. Payne.
Thank you for your question, Representative Cunningham. It's good to see you. So the answer is no, there has not been an increase in the number of nursing homes in North Carolina. In fact, there have been a few nursing homes that, due to the severity of the deficiencies that we have found, CMS has chosen to terminate their participation in the Medicare and Medicaid program within the last few years.
One follow-up, Madam Chair. I'll be quick. On the assessments, when you all come in and do the corrective action plan, we know that your team come in and do the findings. But since the pandemic hit, have we even considered that we need to have a corrective action team prepared to go in and assist the facility to get back into compliance?
So thank you again for your question. So as I'm sure you're aware, the facility is responsible for developing the corrective action plan. And I think that's appropriate given that each facility is unique. And we review that very carefully and evaluate it. We work with them if we feel like their corrective action plan needs to be a little bit more robust. And then, as you indicate, we go back on a follow-up visit to make sure that they have implemented their corrective action plan.
Thank you, Mr. Payne. Senator Bergen.
Yes, ma'am, just very quickly, and Mark, going back to page 13, can you send us a list of where you all are at on inspections, how far you are behind on those 21,054? I know you've got a sheet that says this is when they're due. I'm just trying to see if I can figure out how to help you get caught up. And then on page 17 on CON, can you send everybody a list of every outstanding CON and the date that the CON was issued? There's this whole question about CONs being out there, not being resolved, blocking other people from doing things. So just send us all a list, all the outstanding CONs, the date they were issued, what it was for, and let us look at that. And then I'll have another conversation with you about some other CON issues. Thank you, sir. Thank you, ma'am.
Thank you all so much for being here and for helping out with our program today. Thank you to Susie and Francisco that made it work. But I do have one request. When you send things to Senator Bergen, will you all please send it to at least one of the reps?
Oh, yes,
because we've asked for a lot of things in the last few weeks, and I've yet to receive a copy. But I'm sure he has it. He just has to send it to us. I'm just joking. So thank you all so much. Oh, Jensen?
I was just going to say, yes, we're compiling all of the questions and all of the responses from the and we'll send it to the entire committee.
Right, thank you so
Thank you.
much. Thank you all. Have a good weekend.